Your dog lives with itching, sores, vomiting, or recurrent diarrhea, and no one discovers the cause. The answer may lie in what he is eating every day. Food allergy in dogs is more common than you might think, and when it is not treated at the root, it turns the animal's life into a constant cycle of suffering. You'll find out why swapping kibble for real food can transform your dog's health. This isn't a video with miraculous promises. It's an educational, responsible, and accessible journey that starts on the plate and ends in a healthier, more peaceful life for your best friend. In recent years, the number of dogs diagnosed with food allergies has grown considerably. Not because today's dogs are more fragile than before, but because today we know how to identify signs that were previously ignored much more accurately. Constant itching, excessive licking of the paws, unexplained vomiting, recurrent diarrhea, and even behavioral changes such as irritability or apathy can be manifestations of a chronic allergic response to food. And when the tutor tries everything, changes food brands, cuts out industrialized snacks, changes shampoos and soaps, and even so the problem persists. The problem may be with the plate. More precisely, in the ultra-processed ingredients present in most commercial feeds. Food allergy is not a freshness, and it is also not a condition that is corrected with time. The dog's body interprets certain proteins or additives as enemies, activating inflammatory responses that wear down the animal's immune system, skin, gut, and behavior. And the most worrying, many owners confuse allergy with food sensitivity or intolerance, which leads to misdiagnoses and ineffective treatments. Understanding the difference between these terms is essential. Sensitivity causes gastrointestinal discomfort. Allergy, on the other hand, involves the immune system and affects the whole body. But how to diagnose accurately? The first step is to observe the pattern of symptoms. Food allergies are usually perennial. That is, they don't vary with the season like environmental dermatitis, and manifest themselves with uniform intensity throughout the year. The second step is to seek veterinary advice and, with follow-up, start a protocol called exclusion diet. This protocol consists of offering the dog a controlled diet, with ingredients that are unprecedented for that animal, usually a single protein and a single source of carbohydrate in homemade preparation or supervised BARF. This process can last 6 to 8 weeks. During this time, the dog should consume only the ingredients of the exclusion diet. No snacks, food scraps, or industrialized cookies. The objective is to cleanse the body and observe if there is regression of symptoms. If the animal improves, then the gradual reintroduction of ingredients begins, one at a time, monitoring the reactions. Is it a time-consuming process? Yes. But it's the only sure way to pinpoint exactly what's causing the inflammation. And BARF has proven to be a powerful ally in this process. By opting for a BARF diet as the basis for the exclusion protocol, the owner takes full control over what the dog is ingesting. You can formulate recipes with just one protein, such as rabbit, duck, or lamb, and a single type of easily digestible vegetable, such as pumpkin or chayote. The absence of additives, preservatives, dyes, and ingredients that are difficult to digest allows the dog's body to enter a state of natural detoxification, making it easier to read the clinical signs. Many owners report visible improvement in the first 2 weeks, decreased itching, improved stool consistency, reduced paw licking, and even increased disposition. But beware. Veterinary follow-up is essential, preferably with a professional specialized in functional nutrition or natural food. Only he can indicate adjustments, specific supplements, or possible complementary laboratory tests, such as IgE dosage, blood count, and stool test. The most common mistake at this stage is to give up halfway, out of anxiety, lack of proper guidance, or giving in to pressure from family members who think the dog is eating too little. But this process requires discipline, consistency, and trust. The exclusion phase is the gateway to the body's balance, and when well conducted, it can completely transform the dog's health. One of the main challenges faced by owners when dealing with food allergies is the difficulty in identifying the hidden triggers in generic compositions of commercial feeds. Many brands use the term chicken protein without specifying which part of the animal was used: offal, hydrolyzed feathers, hard-to-digest byproducts, or even waste. And the same goes for ingredients such as soybean meal, corn gluten, or hydrolyzed meat. This lack of clarity prevents the owner from understanding exactly what the dog is consuming, making any attempt at real food control difficult. In addition, the industry usually resorts to palatants, artificial colorings, and chemical preservatives to make the feed more attractive and durable. And that's where the danger lies. These additives, although allowed at levels considered safe, can act as silent triggers of long-term inflammatory reactions. Allergic dogs, especially those that already have a genetic predisposition, are extremely sensitive to these substances. And unlike a natural food, whose effects on the body are more predictable, the artificial components of the food have an accumulative effect, generating internal inflammation that can manifest months later. By migrating to the BARF diet, the owner completely eliminates these hidden factors. The acronym BARF stands for Biologically Appropriate Raw Food. In practice, it is a natural, raw, and fresh diet consisting of meats, fleshy bones, offal, vegetables, and, if necessary, specific supplements. This approach rescues the ancestral nutrition of dogs and offers a digestibility much higher than that of dry food. But more than that, it allows the tutor to put together a personalized menu, choosing ingredients with precision and avoiding any item that could provoke a reaction. For dogs with food allergies, adaptation to BARF should be done in a controlled and gradual manner, based on the results of the exclusion diet. Once safe foods have been identified, the menu can be set up with a focus on balanced variety and slow introduction of new protein sources, always with professional monitoring. For example, if the dog responded well to duck meat and pumpkin during the exclusion protocol, these two ingredients can serve as the starting point of the raw diet. Subsequently, lamb, rabbit, or ostrich meat can be tested, always with an observation interval. An important point is the quality of the raw material used. Many tutors start the BARF without criteria, buying low-origin meats or vegetables with pesticide residues. This can completely compromise the results and even aggravate the allergy. The meat needs to be fresh, of good origin, preferably without antibiotics or hormones. Vegetables should be washed, sanitized, and used raw or lightly processed, as directed by the professional. Another frequent mistake is to exclude fleshy bones for fear of choking. However, raw bones appropriate to the size of the animal are essential in BARF. In addition to providing calcium, phosphorus, and collagen, they help clean teeth and balance the intestinal microbiota, which is precisely one of the main responsible for the body's immune responses. A balanced gut is one of the greatest defenses against allergic crises. It is important to remember that food allergy has no cure, but it can be controlled. And this control depends on continuous surveillance. Once the prohibited foods have been identified, the dog should never consume them again, not even in small quantities, nor as just a little piece. A simple cookie with wheat flour or a piece of cheese can trigger an intense crisis. Therefore, the education of other family members, household employees, or caregivers is essential. BARF gives the owner back the power of choice, control over each ingredient, and the confidence to know exactly what they are offering. But with that, also comes responsibility. And for dogs with food allergies, this responsibility can mean the difference between a suffering life and a balanced, happy, and healthy life. Over the first few weeks after transitioning to the BARF diet, many owners observe visible and impactful changes in the dog's general health, especially when the animal came from a history of poorly resolved allergic crises. The skin begins to heal, the wounds stop opening, the fur gains shine and density, the feces become firm and with reduced odor, the breath improves, and above all, the dog's disposition and mood are transformed. He goes back to playing, interacting, sleeping soundly. It is as if a fog has been dissipated, and it all starts with the simplest act: offering real food. But these improvements can generate a false sense of security. Many owners relax after the first signs of progress and reintroduce untested foods. This is the most critical point of treatment, the post-transition. The allergic dog is like an organism sensitive to invisible noises. Any ingredient outside the protocol can restart an inflammatory process that was controlled. Therefore, even after stabilizing symptoms, it is essential to keep a detailed food diary. Write down everything: quantity, time, origin of the ingredient, signs observed in the following hours and days. Over time, this diary becomes a map of the animal's health. It is possible to cross events, such as an unexpected itch or a mood change, with specific foods or slight variations in preparation. Thus, the tutor stops finding and starts to have real data about what works or not for that dog. And from this solid foundation, the BARF diet becomes a versatile, rotating, complete, and individually adapted menu. There is no magic formula. There is adjustment, patience, and constancy. Another fundamental point that many overlook is the role of supplementation in dogs with an allergic history. Even with a complete natural diet, some organisms need specific reinforcements, such as omega-3 fatty acids, which have proven anti-inflammatory action, probiotics to restore intestinal flora, zinc for dermatological support, and B vitamins to reinforce the integrity of the skin and nervous system. Each supplement must be prescribed with discretion and carefully monitored, avoiding the indiscriminate use of products from the internet without professional supervision. In addition, the dog's routine must be rethought as a whole. Allergic dogs live under constant stress, and stress worsens immune conditions. Therefore, the correct diet must be accompanied by a quiet environment, with predictable schedules, frequent walks, and sensory enrichment. Many tutors focus so much on food that they forget the basics: quality sleep, adequate rest, affection and bonding. And that's where the dog's emotional health starts to respond, reducing inflammation from the inside out. In parallel, control exams should be performed periodically. A dog that has had a diagnosed food allergy deserves constant monitoring. It is important to monitor immunoglobulin levels, liver profile, renal function, and inflammatory markers. This helps prevent relapse and ensures that the BARF diet is covering all of the animal's nutritional needs in the long term. A well-conducted natural diet not only treats but also prevents new imbalances. From that point on, the tutor no longer depends on generic labels, no longer lives changing food at each crisis, nor does he feel lost when entering a pet store. He knows what the dog can eat, he knows how to assemble meals, he knows the warning signs and forbidden foods. It has autonomy. And more than that, he has the peace of mind of seeing his own dog healthy, active, with quality of life, and away from the crises that made him suffer so much. The journey may be long, but each step represents a real gain in well-being. And when food becomes an ally of treatment, what once seemed like a never-ending problem becomes just part of a balanced and happy routine. At the end of this whole journey, a truth clearly imposes itself on any owner who has faced the pains of a food allergy in their dog. The way we feed our animals defines not only their health, but also their dignity. A dog that lives with incessant itching, open wounds, dysregulated bowel and chronic discomfort cannot fully enjoy life. He doesn't run like he used to. He doesn't play as he would like. He doesn't sleep peacefully. And often, all of this is treated with corticosteroids, antibiotics, and special shampoos, while the cause is there, on the plate, every day. The transition to raw, natural food, when done with responsibility, professional support, and patience, transforms the scenario. And not only by removing the villains, but by reintroducing the essential: Real food. Food that nourishes, strengthens, balances. Food that heals. BARF is not a fad. It's a reconnection with what dogs were born to eat. And for dogs with food allergies, it offers something that no food can deliver. Absolute control of ingredients, direct reading of reactions, and freedom to adjust the diet according to the real needs of each stage of life. But it's not just about preparing meat and vegetables at home. It's about understanding your dog's body as a complex, integrated system in which everything communicates: gut, skin, immune system, behavior, sleep, and emotions. Every ingredient that enters the body has an effect. Each viscera, each bone, each leaf or vegetable carries nutrients that act in a specific way. And when the tutor understands this, care is no longer just an obligation, it becomes a gesture of conscious love. So before you accept vague diagnoses like atopic dermatitis or idiopathic allergy, before you begin repeated courses of palliative medications, look at the foundation. Look at the food. Talk to professionals who see the dog as a whole and not as a collection of symptoms. Ask for tests, question labels, ask the origin of the ingredients. Learn to interpret what your dog's body is trying to say. Because he speaks. He talks with his paws, with his skin, with his poop, with his eyes. If your dog is suffering, don't accept that it's normal. Not all itching is a flea. Not all vomiting is unwell. Not all apathy is laziness. Often, it is the body screaming for help in the face of a diet that intoxicates instead of nourishing. And it's up to you to decide, stay on the surface or dive into the source of the problem. Natural food is not the magic solution to all ills, but it is without a doubt the most direct, safest, and most powerful way to restore health, lightness, and vitality to a dog with food allergies. And the most beautiful thing, it is a path that is learned, built, and shared. Because each meal prepared with awareness carries in itself the chance of a new beginning. If you've made it this far, you've already taken the first step. Now it's time to get more informed, seek specialized help, and transform your dog's life with something he will thank in silence. With clean skin, deep sleep, and a whole life ahead of him. Without itching, without pain, without fear.